popularly refer to them as the foot soldier of dentistry, because they are the ones that look after the patient all round. They are the first to see the patient at the time of booking and when the patient comes in and during the procedures. They're also the last to see the patient off when the dentist has finished treating the patient. Sorry.
Okay, so what is the difference between a dental surgeon, a clinical assistant, and a dental therapist?
Thank you for the question. A dentist is what a medical doctor is to medicine, whereas a dental therapist would be what a nursing sister is to a medical doctor. The dental surgery assistant is a grade above the nurse aide, but because over the years they haven't received formal training, which is against international training, we've decided to make sure they are also upgraded so that we have a full package. The dentist is the leader of the dental team. The dental therapist is the mid-level oral health professional. And below the dental therapist, you have the dental hygienist, as well as the dental surgery assistant or nurse. There's also what is called the dental technician, who's often confused with the dental therapist. Just to make sure the viewers know the difference, the dental technician does not work in the dental surgery. He or she works in the dental laboratory.
Okay.
Constructing the prosthesis that have been prescribed or requested by the dentist.
All right. So the dental technician is the one who takes us the x-rays?
No, the dental technician is not even in the surgery.
Oh, okay.
They are far away in a back room or in a commercial lab where they receive jobs from various dentists.
All right. So is the training of dental clinic assistants hands-on? Because these days we now have online trainings.
Okay. I presume you are referring to the dental surgery assistant?
Yes.
Okay. The bulk of the training is actually hands-on. Our program in Zimbabwe is much more advanced, and that's why we made sure we register it with the Ministry of Higher Education and that they be awarded a diploma. At least 10 months of such training must be hands-on in various dental surgeries. We noticed that some programs from overseas are purely online, and when you get such cadres, they are basically non-functional in the clinical area.
All right. So we understand you have a strong passion in dental health. Now, could you tell us more about the inaugural graduation of dental clinic assistants? That's on Saturday?
The dental surgery assistant?
I kept saying the same thing. Dental surgery assistants.
I think I'll be very happy to get a new colleague. Yes, we are very excited about this graduation. We have about 20 dental surgery assistants graduating after 60 months of training. Our training is structured in blocks or modules of 4 months each. It will be at a venue close to the CBD area. It's a carnival atmosphere, a family day. The public is welcome after paying a small entrance fee, of course.
Of how much?
About 50 Zimbabwe dollars, RTGS.
Okay.
So we are quite upbeat. We would like to herald the birth of a new profession in Zimbabwe. The reason I say that is for many years, the dental surgery assistant was uncelebrated because they were literally picked from the street, and each dentist in their own surgery would just train them as they wish. Now with the academy, we give them a standard training. When they're employed by various dentists, it will be up to that dentist to then refine them according to their passion, their specialty, and their focus.
All right, we'd have loved to talk more about this, but we are running out of time. But before you go, quickly to the general populace, oral examination, how important is it, and how seriously should one take it?
Very seriously, because it makes any possible dental treatment less invasive and less expensive. When you go to the dentist on a regular basis and you happen to have cavities which are painless, this is the time when you can receive a filling, a scaling, a fissure sealant, a veneer, depending on your sophistication. So we do encourage that, and I think ZADENU will assist in a long way in making sure that we refocus the public to receive public dental health education.
So it's more of treatment before you start feeling the pain.
And to prevent as well.
And to prevent as well. Dr. Moyana, thank you so much for coming to Good Morning Zimbabwe. And we certainly hope that everybody will now, from now on, start taking their oral health more seriously. We're off to a break now. Do join us after the break as we begin the second edition of Good